Hi, I'm Kathy, Centre Head at Maggie's Wirral. At Maggie's we support people with cancer and their friends and family through the many challenges of a cancer diagnosis. Our busy centre is a warm, welcoming space for you to get answers to the questions you may have about cancer and to deal with the impact it's having on your life. The idea of this session is to explore and learn more about what to expect from chemotherapy. We'll go through what treatment looks like, outline the side effects you might experience, and share where you can get support from. You'll hear from nurses and doctors from the NHS, experts like the staff here in Maggie's, and people who've been where you are now.
As a consultant, I know the benefits this Getting Started session has for my own patients. After attending this session, they come to their treatment much better prepared, with a greater understanding of what to expect, and they feel much more supported throughout. It's also really beneficial for their friends, their family members and their carers too.
I came in here straight away with my mum and brother, and we were just blown away by everybody here. The welcome from the staff and the volunteers, the architecture, the view, and it's just a beautiful, tranquil zen place, which has been a godsend basically to myself and to my family members who sit here patiently waiting for me.
I was just a mess, and so I was really lucky in the fact that I came into Maggie's and managed to speak to some of the staff here, and I left feeling just a whole lot lighter and a whole lot more positive.
I still come to Maggie's, and I would say it's been the biggest single thing which has helped me realise there is a lot more happiness to come in my life, where at one point I thought there wasn't.
I would try and encourage anyone to come in earlier rather than later, because it's so nice just to have somewhere to go that feels kind of like a home away from home. We've all become quite close and quite good friends.
It changes your whole perspective, seeing it working, you know, having the regular consultations and being part of this centre as well just helps you to be able to find those bits of hope and to know that there is life outside of the cancer diagnosis.
Chemotherapy stops cancer cells reproducing, which prevents them from growing or spreading in your body. It can be administered in one of two ways, either orally or into the veins. If it's orally, this will be by tablets and capsules. If into the veins, it will be through a cannula, a PICC line, or a totally implanted vascular access device, often called a portacath.
Before your first appointment, a member of the ward will contact you by phone, or you will get a letter with a treatment time. Your treatment is a priority, so please take the first appointment offered. Your treatment will take place on floor 6 at the Clatterbridge Cancer Centre, Liverpool. Prior to every treatment, you will be asked to have a blood test. This will usually take place at the Clatterbridge Cancer Centre, Liverpool, or at Paddington. They will also give you your future appointment times, as well as the 24-hour contact numbers you may need. You may have heard of a cold cap or scalping cooling to help prevent hair loss. If the chemotherapy treatment you are on is suitable for this, your nurse will discuss this with you in further detail at this appointment. When it comes to getting to and from treatment, we recommend, if possible, that someone else drives you. On non-treatment days, you can drive as normal as long as you feel well enough. Children should also not be brought into the treatment area for their own safety. On the day of your treatment, here's what's helpful for you to do in advance. Have a healthy meal, whether breakfast or lunch. Drink plenty of water and make sure your hands and arms are warm. This will make your veins more easily accessible. Wear comfortable, loose clothing. Bring something to read, watch or listen to when you're on the ward to help pass the time. At every appointment, the nurses will check how you are in case anything has changed. The length of your appointment time will depend on the type of treatment you are receiving. Before you start, there will be time to discuss your treatment with your nurse and oncologist. They will answer any questions you may have and check that you are happy to proceed. They will ask about your current medication, so please bring the tablets you currently take with you. If you're having therapy into the veins, we will have a look at the veins in your hands and forearms and discuss any concerns you may have. If you're receiving your treatment through a needle in your vein, problems can occasionally occur. Therapy can leak into the skin around the injection site, where it can cause the surrounding tissue to become sore and inflamed.
Damage is a rare occurrence, and our nurses are fully trained to try and prevent this. However, there are several things you can do to help us reduce this risk. Position anything you might need during your treatment, like drinks or a book, next to your free hand before your treatment starts. Keep the skin around the drip visible at all times. It is helpful to wear short sleeves or ones that can be rolled up easily. Stay patient. Sometimes it can take more than one attempt to place a drip. If your nurse is concerned about a drip, they will start again in another area. Although this can be frustrating, it is done for your safety. We ask that you don't leave the ward whilst receiving your treatment for your own safety. We also understand your specific treatment may not always be what you need advice about. You'll have a cancer nurse specialist who's part of your specific cancer team and is there to help you through this. Chemotherapy also affects the production of healthy cells too, which is the cause of the side effects you may experience.
In the days after your treatment, you may start to notice physical side effects and emotional challenges too. The team are always nearby and on hand to help you with any worries you may have.
In the days after your treatment, you might start to notice physical side effects and emotional challenges too. In this section, we'd like to talk you through what those might be. These do not apply to everyone, and many go through treatment without noticing them. However, it is still really important to be aware of them and how to manage symptoms if they do occur. Some drugs that are specific to certain treatment regimens can also cause side effects. This can be concerning, but for the most part, your side effects aren't dangerous. In all cases, if you're worried about your symptoms, call the Clatterbridge Cancer Centre hotline on 0800 169 5555. This is a 24-hour, 7-day-a-week service, which is there to give you advice when you need it. When you contact the 24-hour hotline, they will provide advice and, if necessary, organise for you to have a medical review at your nearest hospital. Please do bring an overnight bag and your treatment diary in case you are required to stay in. So let's take a look at some of the possible side effects of chemotherapy. You might feel breathlessness and more tired. This is because chemotherapy can interfere with the production of red blood cells, which carry oxygen around your body. This can occasionally result in anemia, and in some cases you may be offered a blood transfusion. Chemotherapy can also interfere with the production of platelets. These are responsible for blood clotting. You may notice that you bruise or bleed more easily. Your treatment may also interfere with the production of white blood cells. This reduces your body's ability to respond to minor illnesses or infection. You might feel shivery or have a temperature. If your temperature is above 37.5 degrees centigrade or below 36 degrees centigrade and you feel unwell, you must call the 24-hour Clatterbridge Cancer Centre hotline. Please be aware you can have a normal temperature and still have an infection, so if you do feel unwell, you should contact the Clatterbridge Cancer Centre hotline even if your temperature is normal. The best things you can do to avoid an infection are: keep clean, always wash your hands after using the toilet. Clean your teeth regularly, at least twice a day, and regularly drink water. Make sure that the food you're eating has been safely prepared. Clean your hands regularly while at the hospital, using the hand rubs found throughout the wards. Wear protective gloves when doing things like gardening. Stay away from people who you know have an infection, such as a cold, COVID, flu, measles or chickenpox. If you come into contact with someone who has, please contact the 24-hour Clatterbridge Cancer Centre hotline. You may experience diarrhoea, which can lead to dehydration if untreated. This may also be a sign of infection. Equally, you may find you are constipated. Chemotherapy passes out of your body in your urine, bowel movements, and other bodily fluids. This may be harmful to people who come into contact with them. We recommend that you buy a pair of strong household gloves to use for cleaning jobs. Wash them with detergent and hot water before drying and storing them for this use only. You may feel nauseous. Make sure you are taking your prescribed anti-sickness medicines regularly. In order to help, try sipping small amounts of liquids as often as you can manage them. Have a stock of ice lollies or ice pops on hand. Take anti-sickness medication regularly as instructed by your medical team. Eat little and often, and try ginger biscuits or any food containing ginger. You may also start to feel lethargic and easily worn out by activities. You may experience partial or total hair loss, depending on the drugs you receive. This is usually temporary, and there are resources to help in caring for your appearance. You may experience soreness in your mouth or gums, or find you develop mouth ulcers. In order to help, use a soft toothbrush after eating to clean your teeth. Rinse your mouth after meals and keep your mouth and lips clean and moist. Stay hydrated and try to eat soft foods. You may experience dry, flaking skin on your body, hands or feet. This can be helped by applying unperfumed moisturiser. You may also be at a higher risk of developing blood clots in your legs, known as a DVT, or lungs, known as a PE. When is the right time to call the 24-hour hotline? If you feel shivery or unwell at any stage in your treatment, if your temperature is above 37.5 degrees centigrade or below 36 degrees centigrade, or you feel unwell, if your bowels are moving an extra 4 times in a day than what is normal for you, or your stoma output is much greater than normal, if you've not had a bowel movement for more than 2 or 3 days, if you're being sick more than once a day or unable to keep fluids and anti-sickness medication down, if you are suddenly much more tired than normal for you and are unable to manage basic daily activities around your home, if you have a painful mouth, gums or lips and are finding it difficult to eat or drink, or if you have visible blisters on your lips, if you develop more serious skin changes, blisters, bleeding or puffy appearance, if your skin is painful or if you have a rash covering most of your body, if you come into contact with someone who has the measles or chickenpox. However, if you develop chest pain, difficulties breathing, or swelling or pain in your calves, these are emergencies and you should call 999 or attend A&E. You may find that you notice a change in your emotions too. Chemotherapy is a hard thing to go through, and many people experience heightened feelings of anxiety or worry at different points along the way. You are not alone.
Maggie's is a drop-in cancer centre that's accessible to anybody, whether it be the person with cancer or their family and friends. We're here for you at any point before, during or after treatment. Within our team we have very skilled healthcare professionals who have all worked in cancer or psychology for many years. You can talk to one of our cancer support specialists, speak to an experienced psychologist, or find out more about the financial and practical support available to you with one of our benefits advisors. There are courses we run, like managing stress, mindfulness or relaxation, as well as weekly Pilates, yoga, exercise and Tai Chi classes. We offer workshops that provide support for those concerned about hair loss and body changes, or our Where Now course, which is also a great resource for people who've recently finished treatment and helps address some of the questions people often have about side effects and moving forward. Everything we offer at Maggie's is free, and you don't need to make an appointment to see anybody. Our building is in the grounds of the Clatterbridge Cancer Centre Wirral with free parking outside, and you can also reach us over the phone or by email.
I see firsthand the benefits visiting Maggie's has for patients in the long run. Their experience of cancer is better as a result of coming to Maggie's at any point, but especially early on. I really recommend you make Maggie's part of how you live with cancer.
You get a lot of support and guidance. It lets people know that they're not on their own. You know, sometimes this journey is quite a lonesome one, but to be here and to be speaking to other people that have been in your shoes and just to have that support over a cup of tea or coffee and some cake, it's really, it's priceless.
At Maggie's you're in a building with people who are going through something similar. No matter where you are in Merseyside or where your treatment takes place, we're here for you. You don't need to make an appointment, just come in.